Thank you, Christian. Good morning, good afternoon, and good evening. This past Sunday marked World Neglected Tropical Diseases Day. Neglected tropical diseases affect the poorest and most marginalized communities, and the COVID-19 pandemic has made things worse, badly disrupting services to prevent, detect, and treat them. Nevertheless, with support from WHO and our partners, 5 countries eliminated a neglected tropical disease last year. Gambia and Myanmar eliminated trachoma, Cote d'Ivoire and Togo eliminated human African trypanosomiasis, and Malawi eliminated lymphatic filariasis. And only 14 cases of guinea worm disease were reported last year from 4 countries, taking us ever closer to the eradication of this ancient disease, guinea worm. This past Sunday also marked 2 years since I declared a public health emergency of international concern, the highest level of alarm under international law over the spread of COVID-19. At the time, there were fewer than 100 cases and no deaths reported outside China. 2 years later, more than 370 million cases have been reported and more than 5.6 million deaths. And we know these numbers are an underestimate. Since Omicron was first identified just 10 weeks ago, almost 90 million cases have been reported to WHO, more than were reported in the whole of 2020. We're now starting to see a very worrying increase in deaths in most regions of the world. We're concerned that a narrative has taken hold in some countries that because of vaccines and because of Omicron's high transmissibility and lower severity, preventing transmission is no longer possible and no longer necessary. Nothing could be further from the truth. More transmission means more deaths. We're not calling for any country to return to so-called lockdown, but we're calling on all countries to protect their people using every tool in the toolkit, not vaccines alone. It's premature for any country either to surrender or to declare victory. This virus is dangerous, and it continues to evolve before our very eyes. WHO is currently tracking 4 sublineages of the Omicron variant of concern, including BA.2. This virus will continue to evolve, which is why we call on countries to continue testing, surveillance, and sequencing. We can't fight this virus if we don't know what it's doing. And we must continue to work to ensure all people have access to vaccines. At the same time, it's also clear that as this virus evolves, so vaccines may need to evolve. Variants of SARS-CoV-2 may continue to escape neutralizing antibodies induced by vaccines against prior variants. In addition, the reservoir of beta coronavirus is large, and new crossovers to humans is likely. If we prepare now, the time required for large-scale vaccine manufacture will be reduced and lives will be saved. On Friday last week, WHO held our latest global consultation on COVID-19 vaccines research and on the future need for vaccines that are effective across a broad spectrum of coronaviruses. We continue to engage with scientists from the public and private sectors to exchange the latest information and guide the future development of new vaccines. It's one example of how even as we support, countries to fight the pandemic now, we're also working to prepare for the future and to address its longer-term consequences. That includes the challenge of medical waste. Today, WHO published a new report on the burden of medical waste from the pandemic, threatening human and environmental health and exposing the need to improve waste management. Health workers and members of the public rely on huge amounts of personal protective equipment, tests, chemicals, syringes, needles, and other disposable products to protect ourselves and others. But after we have used it, most of it ends up as waste. 30% of health facilities globally and 60% in the least developed countries are not equipped to handle existing medical waste loads, let alone the additional COVID-19 load. This potentially exposes health workers to needle stick injuries, burns, infection, and affects communities living near poorly managed landfills and waste disposal sites. The report makes a set of recommendations, including using eco-friendly packaging and shipping, safe and reusable gloves and medical masks, recyclable or biodegradable materials, and cleaner waste treatment technologies and recycling. The report is a reminder that although the pandemic is the most severe health crisis in a century, it is connected with many other challenges that countries face. Last week, WHO's Executive Board met to discuss the huge range of challenges and how to address them. In particular, our member states asked us to develop a set of proposals on strengthening the global health architecture for emergency preparedness, response, and resilience to present to the World Health Assembly in May. Seeing countries come together to discuss shared solutions to shared problems reminded me of our unity as one species sharing one planet, but it also reminded me of the richness of our diversity. And in that spirit, I wish everyone who celebrates it a joyous Lunar New Year. Christian, back to you.
Thank you very much, DG. With this, we open the floor to questions from the media, and we'll start with Gunilla van Hall from Svenska Dagbladet. Gunilla, please unmute yourself.
Yes, thank you for taking my question. Today, Denmark is one of the first countries lifting all the COVID restrictions. Norway, Sweden are going to follow probably in a week. Other countries are also lifting the restrictions, UK, Ireland. I'd like to have your view on this. How advisable is it to lift the restrictions before a peak in Omicron is reached and while the spread is still massive? And as you said, there are new Omicron variants too that we do not know so much about. What's the danger of an upsurge afterwards? And perhaps if you can address to at what point is it reasonable for countries to actually start lifting restrictions? Thank you.
Thank you, Gunilla, and we'll start with Dr. Maria van Kerkhove.
So thanks for the question. In the last 7 days, more than 22 million cases were reported to WHO, largely driven by the Omicron variant, this variant of concern that is circulating the globe. We know that case reporting is an underestimate, and it's not a great proxy for really understanding virus circulation at the moment. What is more concerning right now for me, and I think for us, is that in the last 4 weeks, we're seeing a sharp increase in deaths around the world. And in all regions, 2 regions are relatively stable in terms of the numbers of deaths that they've reported in the last week, but 4 regions are reporting increasing trends in deaths. And that shouldn't be happening at the present time when we have tools that can actually prevent this. What WHO has continued to recommend is the use of the tools we have at hand. Countries are in very different situations around the world. We have no one solution that fits all. What our recommendations are is to apply the tools to handle two aspects of this virus, this dangerous virus that is circulating. One is to increase vaccination coverage so that we protect individuals from developing severe disease and death. We get patients into the clinical care pathway because early clinical care saves lives. And at the same time, do what we can to reduce the spread of this virus using tools that are readily available, masks, physical distancing, improving and investing in ventilation where we live, where we work, where we study, supporting people to work at home, investing in surveillance and testing. All of that still applies. Now, how countries use these tools is up to them, but we are urging caution because many countries have not gone through the peak of Omicron yet. Many countries have low levels of vaccination coverage with very vulnerable individuals within their populations. And so now is not the time to lift everything all at once. We have always urged caution in applying interventions as well as lifting those interventions in a steady and in a slow way, piece by piece, because this virus is quite dynamic. And we still have a lot to learn from it. Even though we know a lot about it, we still don't know all. And so our advice is to use a comprehensive approach and to use the tools that are at hand. Again, countries are going to have to apply that to the situation that they're in, taking into consideration the spread of the virus, the population level immunity that they have in terms of past infection, as well as vaccination coverage, and in particular, coverage among those who are most at risk, their capacities to respond, the relationship they have with the people within their communities. So all of those are factors that countries have to take into consideration. So we have no one solution fits all, but we are urging countries to continue to use the tools at hand to reduce the spread as well as reduce morbidity and mortality from this virus.
Dr. Ryan.
Thanks, Maria. I think the countries you mentioned are able to put themselves in a position to make a decision like this because they have very high background levels of vaccination. And it really comes from that confidence that having the vast majority of your population protected, particularly your most vulnerable, and countries in this situation get more choices because you get to come down a different way from the mountain. The problem is everyone is on a different part of the slopes of this pandemic mountain. And it's really, really careful in this situation that one country just doesn't blindly follow the next, because that's one way you can fall. Every country has to find its feet, know where it is, know where it wants to go, and chart its path. You can look to the experience of others, you can look at what other countries are doing, but please don't just follow blindly what every other country is doing. Chart your own path, as Maria said, based on your current epidemiology, your demographics, your population at risk, your vaccination levels, your population immunity, your access to tools, the strength of your health service. And each country can chart a path out of the pandemic by taking that approach. Again, the countries that you mentioned have very high levels of vaccination, very, very strong health systems. And yes, there is a calculation here. And every country has been trying to make this calculation right since the beginning of this pandemic. How do we have maximum protection of our population while minimizing the impact on our society and our economy? At the beginning of this pandemic, without a vaccine, a lot of that was based on having strong public health and social measures. What's happening is high vaccination levels are beginning to give countries more choice when it comes to the stringency and the severity of those measures. But those measures may still be needed. And certainly individuals need to be left with a choice themselves. And certainly we don't want to see, there are many, many people, in my own personal view, who will be well advised to continue wearing masks in crowded situations in public transport. Even if it's not mandated by government, there are people who will want to make that choice. And it's very important that we let people make that choice because they're trying to protect themselves and ultimately protect others as well. So I think it's a transition phase for many countries, not every country in the same situation. Those countries who are making decisions to open up more broadly also need to be sure they have the capacity to reintroduce measures with community acceptance quickly if needed. So as if you open the doors quickly, you better be pretty well able to close it fairly quickly as well. And therefore, it's important that we keep communities informed and maybe ensure that communities understand that measures may have to be reintroduced in order to moderate transmission if there is an unexpected rise in transmission, or if Maria has alluded to, if a new variant emerges. So flexibility, agility, the ability to adjust, making good decisions based on your situation, and being ready to change that if needed. I think all countries will find a way out. So we should be, in some ways, celebrating when countries get to another stage of disease control, but at the same time being cautious and know that not all paths are straight.
Okay.
Thank you very much, both. Next question goes to Corinne Gretler from Bloomberg. Corinne, please unmute yourself.
Hi, thanks for taking my question. South Africa has dropped the isolation requirement for people who test positive for COVID but are asymptomatic. Do you know of other countries that have done so? And from an epidemiological standpoint, is it a safe thing to do?
Dr. van Kerkhoff.
Yeah, thanks for the question. So we are constantly looking at data as it emerges on all of these variants and our understanding of the epidemiology. You know, how does this virus spread and what do we know about that? We have recently looked at data that is available on the Omicron variant in particular as it compares to other variants of concern and looking at the infectious period of when people, you know, are infected with the virus and when they're able to pass the virus to others. And we look at this in terms of severity, whether people have symptoms or not, through their disease progression. We look at this if there are any other factors, underlying conditions, immunocompromised, et cetera. And our understanding of transmission with the Omicron variant is very similar to what we know about the other variants of concern in terms of when people transmit the virus. Most people still transmit the virus right around the time they develop symptoms, from about 2 days before symptom onset up through the first 5 to 9 days. If you're mild, it can be longer if you have severe disease, and it can be even longer if you are immunocompromised. Asymptomatic individuals can transmit the virus as well. So what we do as WHO, as an evidence-based organization, we issue guidance to give countries the information that they need to set the policies that they need for isolation of confirmed cases, for quarantine of contacts of those confirmed cases. But there's a difference between what guidance says in terms of the evidence and the policies that are made. And the reason I mention that is because our recommendation for isolation is to prevent onward transmission, and as much of that onward transmission as possible. But in some countries, what they have to do is they have to shorten the isolation period or the quarantine period when they take into consideration other factors, the risk of onward spread, but also the fact that many people, and in the context of having so many cases of Omicron and so many contacts of cases of Omicron, that there's a large number of people who are in isolation or quarantine. And so when they set those policies, they're making changes to shorten the isolation period or the quarantine period because they need to keep other operations going. So we do know, and there's risks and there's benefits to that. So for Omicron, we do know that people who are asymptomatic can spread the virus, but most of the people who transmit it's really right around the time of symptom onset. So there is some pros and cons that are associated with those policies that countries are implementing. But as I said, a lot of the reasons why these policies differ is because the decision makers have to set the pros and cons of keeping other services functioning.
Thank you very much, Dr. van Kerkhoff. Next question goes to Simon Ateba from Today News Africa. Simon, please unmute yourself.
Thank you for taking my question. This is Simon Ateba with Today News Africa in Washington, D.C. And congratulations to Dr. Tedros for his second term in office as you guys continue to battle COVID-19. My question is to Doctors Maria van Kerkhoff, Mike Ryan, and Kate O'Brien. Doctors, Are you concerned that you're on the brink of losing most of your political allies, from the US to Canada to the UK and elsewhere, with massive losses in the upcoming election because of the confusion around COVID-19 and the inability of those politicians to understand that life should move on with vaccination? For instance, what will your answers be to those who ask this question? Why should we keep wearing face masks when we are all fully vaccinated and boosted? What guarantee do we have that new variants will not continue to emerge? How long will we keep wearing face masks and killing social life and businesses? I thought you told us vaccines work. Do they work? Do they not work? And when will life return to normal? Are pharmaceutical companies and doctors like yourself, Pfizer, Moderna, and Johnson & Johnson, just trying to push yearly vaccination to make more money? Thank you.
Well, thank you, Simon. But it's a good point for me to remind everybody, please just stick to one question, not to a catalog. We also went through part of this already in the first question, but I think we'll give it a shot with Dr. Mike Ryan.
Thank you, Simon. And you asked a lot of questions there. You also gave a lot of your own answers. So I struggle to respond because there's so many issues that you raised. But I do think within what you said, there's a validity in recognizing that people in many situations now really want clarity around what is the best thing for them to do for themselves, for their families. How do we get out of this pandemic together? How do we end the emergency phase? And how can we all get back to some semblance of normal? The difficulty is that that's a very different question and a different answer depending on where you happen to sit in the world. If you happen to sit in a Western industrialized country with a strong health system, with access to vaccine for the last 18 months, where the vast majority of your population have had 2, if not 3 doses of vaccine, and you have access to antivirals and a strong primary healthcare system, and everyone has access to hospital and oxygen when they need it, then you might be very close to ending the emergency phase of this pandemic. There are many places where that is not the case, where vaccination levels are still very low, where we have weak health systems, where people haven't had access to vaccines, haven't had access to antivirals, haven't had access to oxygen, and they still remain at great risk from this virus. And after 2 years of a pandemic response, the inequities of this response, both within countries and between countries, are still stark. So from that perspective, each person, depending on where they sit, needs to probably ask a different question. Sometimes it's difficult the individuals in this, and everyone's been affected by the restrictions, the restriction of not being able to move around or having to wear a mask. But the sacrifices in that have been done to save many lives. They've been done to protect health systems. They've been done as a community. They've been done with pride and with honor by so many communities around the world as a means to save so many lives. So we should be, as we look at the collective sacrifices that have been made, a lot has been sacrificed by individuals, but a lot has been gained by society in terms of the life saved and the health protection, or the protection of the health system. So we should praise our communities and we should recognize what they have sacrificed, but also not to say to them that their sacrifice has been without worth, or that we should never have had these things in place. We shouldn't have had physical distancing. We shouldn't have had to wear masks. The fact is, we did, and we needed to, and lives were saved. Now we have to chart a path where we can begin to lift those restrictions, but we need to do it carefully, and we need to do it transparently, and we need to tell our populations that we're doing it for this reason because we have taken these other measures. My greatest fear at the moment, to be quite honest, Simon, is that countries have a lemming syndrome now, and they all chase to open up. And they open up on the basis that the country next door opened up. And the problem is, they don't have the same situation. They don't have the same vaccine coverage. They don't have a strong health system. And I'm really fearful that while some countries have the opportunity to raise measures more than others, others may choose that because there is political pressure to do that. And that political pressure will result in people in some countries opening prematurely and that will result in unnecessary transmission, unnecessary severe disease, and unnecessary death. Bruce, you want to come in?
Thanks, Mike. Simon, it was just one of the points that you made at the beginning about the support of countries for the work that the group here is doing and WHO in general. And it just reminded me a little bit, we spent the last week with the executive board of WHO, which brings together the executive board itself, but also the broader 194 member states that work with the World Health Organization. And, you know, there was an extraordinary, let's say, display of support for the Director General, for how he's managed the COVID for response, how he's leading that, and also in terms of the role that the organization needs to play as it goes forward. So I think to the very first question that you asked, it really drove home just how this has affected everyone, all countries, as Mike alluded to, but also the support and the recognition that the world needs a very strong World Health Organization, a strong consensus among countries to that effect, and an organization that is enabled, let's say, in terms of its financing, its staffing, et cetera, to play that central coordinating role in crises like this as they go forward. Yes, there will always be tensions. Yes, there will always be stresses. It's difficult for everyone. But to that very first question, I think the organization is right now has a tremendous support of its member states. And it's that solidarity which is going to be crucial across the member states to get out of this.
And we have Dr. Kate O'Brien as well.
Yeah, a couple points that I'd like to add to the multifaceted question that you asked. The first is that you asked us what would we say to people who are still hearing about the need for face masks and the other interventions. And you know, we and others have been clearly communicating about vaccines. Vaccines work. They especially work when people get the vaccines that are offered to them. We know that for people who are hospitalized in countries that have wide access to vaccines, the vast majority of those people are unvaccinated individuals. So we still have a huge issue, even in countries that have had for many, many months broad, unfettered access to highly effective vaccines, and people have not gotten their doses. So I think one of the most important things is that there remain a large number of very vulnerable people who are subject to a lot of false information and misinformation that's resulting in them making decisions to not receive what is a life-saving intervention. We also know that in countries that have not had access to those vaccines, there's a long way for those countries to go now that supply is more available for those who are most vulnerable to be vaccinated. So I think we want to emphasize again and again that the vaccines are working. For Omicron, the evidence on the importance of booster doses for the highest risk, the highest priority groups, I think is quite clear. And that we still have 30 countries that have not yet been able to get to even 10% of their population vaccinated, not because they don't want to, not because they can't, but because for many, many months in 2021, vaccine was inaccessible to them. And that's a really changing dynamic. And I think the other thing to say is that these vaccines are not perfect. They've never been perfect. But the more people who receive vaccines that are interrupting, they are protecting against especially the most severe end of the disease spectrum, and they are performing against infection and transmission, although imperfectly. But the more people get those vaccines, the more impact there will be on reducing transmission. So I think those are the sort of hopeful messages that we have incredible tools available, and the access to those tools is becoming greater and greater, over 10 billion doses now administered, and more vaccines every month as we go forward. So I think this is the message, along with all of the other things that people can do to keep themselves safe as we work our way out of this part of the pandemic.
Thank you, and we also have Dr. Soumya Swaminathan.
Yeah, sorry, I know that we were supposed to have one question, one answer per But I think that you raised a number of important things. What I wanted to pick off on what Kate was saying was about the amount of misinformation that's circulating around one of the issues that you raised, and that is that the vaccines are not working, people are still getting infected. And I think that, the vaccine skeptics or the anti-vaxxers are using that actually to fuel this fuel a belief that these vaccines are not working, we should just give it up because you're going to get infected anyway. And that's very far from the truth. I think Kate did explain that these vaccines are working very well, and there's more and more data coming out. Even yesterday and today there were new papers showing that the cell-mediated responses, the T-cell immunity is holding up surprisingly well, even with this Omicron variant with so many mutations. And therefore, the originally developed vaccines are still working to prevent severe disease and death, which is what we want, even though they may not be as good as preventing infection. But we're already one step ahead. And the DG mentioned that we continue to have consultations, but last Friday there was an amazing meeting that was organized by the R&D Blueprint here, the team here, which had over 1,300 people attending from all over the world, with a very healthy and robust debate on the future of vaccines, the next generation of vaccines, how can we make better vaccines, not only to protect against infection, which means you want to generate some mucosal immunity as well, but also vaccines that can protect against a broader array of coronaviruses, what are called sarbecoviruses, so that we are prepared for future variants. And so while we must continue to vaccinate people with the excellent and existing vaccines, we're already looking at the next generation, how to be better, and perhaps even one day have a universal coronavirus vaccine that will protect us against all known coronaviruses. Thank you.
Thank you very much, all. And next question goes to Maria Cheng from the AP. Maria, please unmute yourself.
Hi, thanks very much for taking my question. Dr. Tedros, thanks for your New Year wishes. Kungi Fat Choi to everyone there too. I have a question related to a story the AP published last week. Given that WHO has yet to fire any senior management staff who were aware of the sex abuse in Congo, even after evidence was published, would Dr. Tedros consider terminating Dr. Kasai's contract amid the racism and abuse allegations we reported last week, as some member countries have suggested should happen? Thank you.
Thank you, Maria. Let me take that, because as the DG has said at the executive board meeting, WHO has been made aware of some of the concerns since late 2021, and we have been following up. WHO is committed to a respectful and safe working environment across all three levels of the organization, and we will take firm action, including disciplinary and other appropriate measures if staff, whatever their rank, is found to have engaged in abusive conduct. Thank you. With this, we go to the next question, and that goes to Juliet Pirar from Nikkei. Juliet, please unmute yourself.
Yes, hi. Thanks for taking my question. My question is regarding the origin of SARS-CoV-2. And I was wondering if researches on origin are still going on, and if the international team have planned to go back to Wuhan in China where the outbreak took place. Would it be possible to have an update on it?
Juliet, we had a very bad echo here in the room. I'm looking around if people understood your question. Though maybe you can try the key question again and go a bit off the microphone. Maybe that's the reason why it echoed so much.
Can you hear me now?
We hear you, but it's a bad echo.
Okay, so I'll try. My
Yes.
question is regarding the origin of SARS-CoV-2.
We think you
I was
understood?
wondering.
Okay, Maria van Kerkhoff will give it a try.
Yes, thank you. Sorry, it was a bad echo in here. Wanted to make sure we understood your question. So yes, there is quite a bit of work that's ongoing to better understand the origins of this pandemic, the SARS-CoV-2 virus. And as you know, we, as WHO, we established a new scientific advisory group called the SAGO, the Scientific Advisory Group on the Study of the Origins of Novel Pathogens. This was initiated over the summer, and over the last series of months, we have formed this scientific advisory group. We have 27 excellent advisors from all over the world with many different disciplines that are working with us to better understand what is next and what is needed to better understand the origins of this pandemic, as well as to outline a framework for the study of each and every time we have an event where there's a known pathogen that spills over from animals to humans, or there's a new virus or a new pathogen that emerges. The SAGO has met several times. In fact, we've had about 6 meetings of the SAGO itself. We have a chair and a vice chair that are running these meetings, and the Secretariat is supporting this. The work is very dynamic in terms of what they are focused on. They're focused on 3 things right now. One is the overarching elements of a framework for the study of any emerging pathogen. Second is to look at what is our current understanding of the origins of this particular pandemic, building upon previous missions that have gone to China and worked with Chinese scientists, the last of which published a report in March 2021, and then looking at all of the literature and evidence that exists to really look at the studies that have been conducted since that team came back. This group is currently working on their first set of recommendations to WHO. As a scientific advisory group, their job is to make recommendations to the Secretariat for what is needed next. And what they will be focusing on are what are the real urgent needs in terms of the studies that are necessary. And what they're looking at are the early epidemiologic studies. You know, what do we know about those earliest suspected and known cases that were reported in China? What is known about animal susceptibility of SARS-CoV-2, of different species that can be infected with this virus? What is known about animal trade? What is known about SARS-CoV-like viruses in bats anywhere in the world? What is known about any of the earliest indications of detection of this virus, either in wastewater samples or stored clinical specimens or sera from anywhere in the world? And they are compiling all of that information right now to outline what are the current next steps. So we are expecting the report in the coming weeks. We will be reporting that to our member states first, and then that report will be made public. But there's certainly a lot to do. Many more studies are necessary to really understand the emergence of this virus. We, as WHO, won't stop until we exhaust all avenues to better understand this. But what I can say is that the group is working very hard. I can say that there is a lot more to be done. And as we learn more, we will report that to you. So it's a work in progress. But it is really critical that we continue to look for the origins of this particular pandemic, as well as prepare for any future ones.
Thank you very much, Dr. Van Kerkhove. Next question goes to Erin Bunko from Politico. Erin, please unmute yourself.
Hi, all. Thank you so much for doing this. Just a quick question for any of you who want to answer. Is the WHO goal of vaccinating 70% of the world's population by mid-2022 still an attainable goal? If not, why not? And can you speak to some of the barriers we're still seeing for getting low and middle income countries vaccinated? Thanks.
Thank you very much. Dr. Kate O'Brien, please.
Thanks so much for that question. As you know, the vaccine strategy did lay out a goal of, by the end of June, 70% coverage, not only globally, but in every country, so as to really express the equity of coverage. The objective was not strictly just a global goal where some countries were very far ahead and other countries very far behind. We're supporting countries very intensively in their efforts to achieve those goals, and the interim targets, the interim milestones of 10% by the end of September and 40% by the end of December are ones that I think have been extremely helpful for countries to both set out these targets by which they could then achieve those ambitions. And we do see that, of course, there are countries that are still far behind, 30 countries that haven't yet reached the 10% target And as of yesterday, 83 countries that were below the 40% target by the end of 2021. So in these countries, there's a lot of work to do. But I want to point out that these are all countries, with very few exceptions, that have achieved massive coverage goals for other vaccine purposes. These are all countries, especially in the Africa region, that have gotten rid of polio. And they've done that through massive campaigns of polio vaccine. These are also countries that are controlling other diseases, other vaccine-preventable diseases, through the use of vaccines and deployment through large campaigns, meningitis type A, certainly measles, yellow fever, many other campaigns that are carried out. So these are countries that know how to stand up campaigns. But there are a number of impediments, and first and foremost, the impediment has been that we can't look at just the past 2 months or 3 months of that vaccine supply as if that vaccine supply had been present throughout the course of 2021. This is a recent change that countries now have access to supply in a way that they can do adequate planning for large campaigns to secure this rapid increase in the absorption rate of turning vaccines into vaccinations, going from airports to arms. So there is a lot of work to be done by countries. These are also, for some countries, those that have real constraints on the number of healthcare workers that they have and a number of other elements that are necessary in order to stand up large campaigns that will assure that the people who most need the vaccines are vaccinated. We're also watching carefully and supporting countries to assure that as much as possibly can be done, that the priority populations are going first, and that means healthcare workers. As we've looked with countries across the immunization of healthcare workers, we're seeing a very substantial increase in the number of healthcare workers who are vaccinated, as well as those over the older populations, however a country is defining that. That may be over 60 or over 65. However, some of the barriers for these countries include access to funding in order to actually deploy the campaigns that they are so able to plan and deploy. And that means getting funding when and where it's needed at the district level, at the clinic level, so that the actual healthcare workers and the things that are needed in order to stand up a campaign are adequately funded. It also means doing really good planning so that the healthcare workers that are deploying vaccines are not taken away from other essential services. And again, we're supporting with an intensification of the operational support to the countries that are most in need of operational support, along with our sister organization, UNICEF, along with Gavi, along with the World Bank, along with the African Union, the Africa CDC, and all partners in all regions where there are countries that are far behind. We are very confident that the supply, as long as no substantial stepbacks are made from providing supply, that we would really like to see, and we are very hopeful that the supply will continue in a way that allows countries to achieve these objectives. And COVAX is continuing to deploy hundreds of millions of doses both this month, next month, and in the months to come to assure that there is that supply available to countries. We are optimistic that especially those who are in the highest risk and the high-risk categories will have vaccination in a timely fashion.
Yeah, thank you. Thank you for that question. It's very important, and Kate has really covered it, but just would like to add a bit to the question you asked, whether 70% by mid-2022 is possible or not. It's not only possible, it's more than possible to achieve that target. That's why I hope you may remember many times I said ending this pandemic is not a matter of chance. It's a matter of choice. So if we make the choice of delivering the 70%, which is within capacity, then we can end the pandemic. So we hope, countries will deliver on this, especially the countries who can contribute in terms of, giving support to the countries who cannot have or who don't have access to vaccines. The last few months, as Kate said, we're seeing progress. And as you know, COVAX has now delivered more than 1 billion doses, and we expect constant flow. But still, I don't want to go into what Kate said. There are still challenges that we need to address, but the world has the capacity to reach not only 70%, even beyond that by mid-2022. So that's why we say it's a matter of choice, and I think the world should choose to vaccinate 70% and end this pandemic. As you know, everybody is sick and tired, and Simon's question was exactly that. And the world cannot stay this way any longer. And we have to end it, and we have the means to end it. Thank you.
Thank you very much. Next question goes to Robin Millard from AFP. Robin, please unmute yourself.
Thank you. A question about the BA2 subvariant of Omicron that Dr. Tedros mentioned. So what do we know about this BA2 strain? Is it gaining ground? Is it more transmissible than BA1 Omicron? And is it something that people around the world should be a bit more concerned about? Thank you.
Thank you, Robin, and we'll start with Dr. van Kerkhove.
Thanks. So BA.2 is one of the sublineages of Omicron. So BA.2 is Omicron, and it is a variant of concern. It's in the family of the variants of concern around Omicron. I think what is really important is that we have really good surveillance around the world so that we better understand all of the subvariants of Omicron. What we understand about most of the sequences that are available and most of the research that is available is on the subvariant BA.1. But the incidence of BA.2, the prevalence of this in some countries, is increasing. And in particular, we have some information in Denmark and in India where BA.2 is increasing in terms of its circulation. There's not a lot of information that we have on this particular subvariant yet, but because it is part of this package of Omicron, we do know, obviously, that there is increased growth rate compared to other variants of concern. There is a suggestion that some of the initial data on BA.2 is that there's a slight increase in growth rate above BA.1. But beyond that, the data is really quite limited. For people out there, we need people to be aware that this virus is continuing to circulate and it's continuing to evolve. And so that's why it's really important that we take measures to reduce our exposure to this virus, whatever variant is circulating. And Omicron is becoming dominant worldwide. It's overtaking Delta in a number of countries and around the world. And we also take the vaccine when it's our turn so that we could reduce the opportunity to develop severe disease and death. Vaccines, as you keep hearing us say, the vaccines are incredibly effective at preventing severe disease and death. And this is true for Omicron, all of its subvariants. So we are working with literally thousands of experts around the world to be able to track and trace this virus and its sublineages, including BA.2. We are working with researchers around the world so that we better understand the studies that are underway to look at any potential changes in terms of our understanding of how this virus spreads or severity. There's no indication that there's a change in severity. Omicron overall we know is more transmissible. It has more growth advantage, and it causes less severe disease compared to Delta, but it's still a very dangerous virus. So it's quite a dynamic situation where we're getting information in real time. We're using that information across all of our technical advisory groups, technical advisory group on virus evolution, our technical advisory group on vaccine composition, the SAGE, and many different working groups to assess these variants. But I think for the general public, what is important is that you understand that this virus, whatever this virus invariant that's circulating, you have tools that can keep you safe. And this is the main message we want to get out there. Get the vaccine when it's your turn, and make sure that you take steps to lower your exposure to this virus through your daily activities. And so as we learn more about BA.2, we will share that through our various channels.
Dr. Mike Ryan, please.
And just to add that we're in a new era, really in our capacity collectively to track viruses like this. In days gone by, we probably wouldn't even know there were new lineages until we saw an impact in the community, and we'd be going back to try and work out what was going on. That was often the way we found things out. What we're able to do now is prospective. We're able to look at the virus as it changes its genotype, its genetics, and we're trying to predict how it will behave in the real world, its phenotype, and beginning to look for signals of shifts in the behavior of the virus in terms of transmission or virulence or vaccine escape. That gives us the agility then to shift and move our measures, shift and move, strengthen our health system. So we should see this as a real advance in scientific collaboration and the ability to do predictive analytics for how and to build that collaborative intelligence that we all need to be able to better understand the risks associated with these emergencies. But that's very different for the ordinary person in the street. Doesn't need to wake up every morning and worry about BA1 and BA2 and, there are more numbers out there, that is not what should concern people. I think what people should be reassured by is that there is a really wonderful group of scientific institutions all over the world who are collaborating every single hour of every single day. They are tracking these variants, they're tracking the sublineages, and they are going to know in good time if the behavior of the virus is changing, and that will allow us to make good decisions in public health and policy. That should reassure people more than what is a genuine concern when we hear new names of new lineages and new variants. We have to balance that concern with the reassurance that comes with knowing that the scientific community has advanced probably more in the last 2 or 3 years in this area than it did in the previous 2 decades. That should reassure people.
Thank you very much, Dr. Ryan and Dr. van Kerkhoff. With this, we come to the end of our briefing today. Apologies to those journalists, and there are quite some whose questions we couldn't take. There's a long list today, but we're glad that so many of you are interested. Again, thank you for your participation. We will be sending the audio files and Dr. Tedros' remarks right after the press conference, and the full transcript will be posted on the WHO website tomorrow. With this, let me hand over to the DG for the final remarks.
Okay. Thank you, Christian, and thank you to those who have joined us today, and see you next time.